Would you just take that?
Yes. Well, as you said, I'm a basic research scientist who works in a lab, so I listened with great interest to what my colleagues were telling me on this panel. And of course, the vaccine area is a subset of what Joanna is addressing. It's a very specific subset. It's something we're all familiar with and something that is extremely effective. Now, just to put it in perspective a little, the calculation that was put forward was that about 2 to 3 million people die worldwide each year from diseases that are completely preventable with current vaccines. And on the other hand, over the last years, the integrated international vaccine effort has certainly saved 2 to 3 million people each year using just those vaccines. Now, we have had enormous success in the vaccine area. We're constantly rolling out new vaccines, though they are getting more expensive. It was the myth for many years that vaccines are an extremely inexpensive way of dealing with disease, but they're no longer that inexpensive, but they are extraordinarily effective. The question is then how we make sure that these vaccines get to everybody and that we implement these programs so that they're working effectively. And it was identified, as you suggested in your question, that though we do have a very substantial effort, there is still a lack of a coordination, a level of responsibility that we need to address, and that we need to give individuals or groups much more responsibility, but at the same time make sure that they're accountable for achievable goals. What was being suggested, in effect, is much more of a business model. And of course, many of the people sitting on our panel are substantial business people, because the vaccine area, of course, is a business. Now, with respect to the issue of empowerment and involvement and local community involvement, this was felt to be enormously important. Anyone who's been involved in the vaccine area, even in the developed world, knows how quickly stories can get around about the damage caused by a vaccine. And of course that can also happen in the developing area. We know what happened with the poliovirus vaccine in Nigeria, for instance, where a totally erroneous idea emerged that it was suppressing reproduction, and how dangerous and damaging that was, and how much damage it did to the international effort to eliminate poliovirus. So the message that there must be local ownership and involvement is enormously important. Now, what we heard from some of the people who were speaking, from the companies, and particularly from the Institute Pasteur, and the Pasteur, of course, has a long involvement with establishing institutions in developing countries and has a very large number of collaborating institutes throughout the world, as we all know. Local production facilities are being built. There are plans to roll out more and more of these so that the product is being produced locally. Emphasis was placed on the fact we must have very accurate diagnosis locally. You don't want to be giving people the wrong vaccine. And we need to internationalise that much better than it is at the moment. And also to involve local people in the actual delivery and in the way these mechanisms operate. And so this idea of local ownership so that it's regarded as a community effort that works within the country itself, I think is enormously important.
Thank you, Peter. That was summarised on pages 16 and 17 for those of you, and I think the takeaway home message was we better use better the products we already have in hand. I know that very often Joanna keeps saying this, stop looking and relying that, it's got to be some new technology. We've got a lot there right now in this field of immunization, Peter, and as you say, the involvement of the local community to use better the products we already have in hand is perhaps your take-home message that I see. Is there anything you want to add to that?
Yes.
We go on?
The other thing, of course, with the vaccine area is that there's this 1,000-pound gorilla hanging out there, which is HIV/AIDS.
Right.
And we calculate something like 11,800 people are being infected every day with this virus. And at the moment, there is no real progress with vaccines. There are some 30 vaccines in test. Even if any of those work, they wouldn't be available before at least 2015, and it's highly unlikely that any of them will work. What's needed in this area is much more basic science, new insights, new concepts, and a much more adventurous approach to how we fund that science. There's no lack of funding, I can tell you that. There's a lot of AIDS research money looking for new ideas, but there are not many new ideas. So at the moment, we're not really talking about vaccines when we're talking about handling HIV/AIDS.
Well, this seems to be one of the few places where the finance is there looking for the solutions, and the others are looking for the finance.
And from governments, from foundations, from Gates and so forth, there's a lot of money out there. So there's no lack of effort. It will continue to be a major problem, but the more we put into public health type approaches at this stage, and to education, and again into involving the community in the processes that are used, so that there's a sense of involvement and ownership in what's being done, it's going to be enormously important.
Thank you, Peter. Before turning to cellular therapies, I see that Jennifer and Joanna might want to say one or two words on this immunization issue. Go ahead, both of you, Jennifer, and then
Peter. I had a question about Africa and vaccines, and the question of cold storage.
Yes, this is a problem with live vaccines, of course. If we've got a kill vaccine, we don't have to worry about it. The great success with vaccines, of course, was the eradication of smallpox, and that's a live vaccine, but this virus is so tough that you can handle it under very minimal conditions. So that means if you're going to have a cold chain to deliver your vaccine, you're going to have a very, very coordinated program on the ground, which is why it's so important, again, to have local involvement and local ownership. One of the suggestions that was made, and I thought it was quite a useful one, is that there are well-established networks for delivering veterinary vaccines. It's a sad fact, but veterinary medicine is based in economics, and human medicine is not necessarily seen in that way, and sometimes the life of a cow can be more valuable than the life of a human being. So the veterinary services are often extremely well organised, and if we were to coordinate cold chains for veterinary vaccines with cold chains for the human vaccines so that you had a simultaneous protocol. So this again gets to the question of governance and organisation within nation states. And of course that's a very complex issue. As we know, there's not a whole lot we can necessarily do about it. And of course one of the degrading factors in this, of course, has been the loss of many professionals through HIV/AIDS. And so it is a complex issue, but I think there are better ways of doing it, and I think one that came out here could potentially be quite useful.
A question or comment from you, Joan?
No, I wanted to go back to the issue of health systems, because one of the major bottlenecks in terms of achieving all of the health goals is actually the lack of human resources for health. So even if we scale up and are able to deliver the solutions in terms of vaccines and drugs, we have to bear in mind that we are talking about people and children who live in remote villages. That's where majority of them need that help. And in those villages, not only don't we have access to any doctors, there are no nurses, and there are very rarely even community health workers. So unless we actually address that problem, we will not be able to reach the goals.
And in some of the most fragile and vulnerable countries, one of the greatest exports is, unfortunately, health workers themselves.
Yeah.
Even the vertical programs contribute to internal brain drain,
right? Because
those NGOs are often being able to pay more for the few nurses and doctors that work in this country, and they get recruited into this vertical program.
I think this is a cross issue, and I'd like to come back to it. And anyone who has comments from his own area, we've seen this very often, please feel free to jump in. Before we do, I'd like to turn to our chairman representative, actually the only one of industry here, Andrea Rapagliosi, who is Vice President of Health Policy and Government Relations at Merck Serono.